Hi, so I'm Dr. Gerald Evans. I'm the Medical Director of Infection Prevention Control here at Kingston General Hospital. This time of year we worry a lot about infections because there's a higher frequency of a lot of different infections that occur in the winter season, and they really start to rev up right around the holidays when everybody's together. We worry about a number of viruses. Probably the most important group are the respiratory viruses, and people think about influenza and the common cold, and even unusual viruses like respiratory syncytial virus or parainfluenza. There's an interesting difference between the common cold and influenza, not the least of which is the common cold is a mild illness and influenza is a very severe one, but in the way that they are transmitted from person to person, they differ. The common cold really is a virus which is transmitted through inanimate objects, or what we like to call fomites, so door handles and other things, as well as your hands. So when it comes to preventing transmission of the common cold, and when it comes to preventing yourself from getting the common cold, probably the most important measure that you need to have in place is to wash your hands and be careful with inanimate surfaces, making sure they're clean. Now that's completely different than what we see with influenza. In influenza and RSV and other viruses, droplet transmission is probably the most important means by which they get passed from person to person. And that happens when a cloud of droplets forms around a person who's suffering from the infection, in which the droplets carry the virus. And if you're in close contact with people like that, within about a meter of them, then you're likely to pick up the virus and at least potentially get sick from it. So in those circumstances, hand washing is still very, very important, but then also measures to prevent that sort of large droplet aerosol forming around you by ensuring that you cough into your elbow, not onto your hands, and other kinds of hygienic precautions are really important. The other group of viruses that come into play at this time of year, which people don't really appreciate, I think, as much, are the gastroenteritis type viruses like norovirus or norwalk. And those actually have such a seasonality to them that the illness that they cause is often referred to as winter vomiting syndrome. And this is an illness where you suddenly, within a very short period of time, develop very severe vomiting, sometimes associated with diarrhea. And that virus, again, is transmitted primarily through sort of fomite spread, through contact with surfaces and hands. And so, again, underscores the real importance of washing your hands and keeping hygienic precautions in place, including with food handling, since these viruses are obviously going to be greatly facilitated through transmission to food and stuff. So this time of year, it's really important to practice all those measures that you do all the time, which is to keep your hands clean, to make sure that you're being careful with your own personal hygiene when it comes to coughing and sneezing. And all of those measures altogether will really help you to either prevent yourself from getting the infection or at least transmitting it to other people who are around you.